Hello everyone, welcome to this video, the title of which is How Skin Cancer, specifically melanoma, gave us a medicine for strokes called tPA. Let's get right into it. On the outset, this idea seems preposterous. How could a harmful substance like a cancer give us a cure for anything? But actually, medicine is rife with the serendipitous or surprising discovery of novel cures out of harmful substances, like toxins and venoms. Just to give two pertinent examples. Number one, the venom of the Gila monster, a lizard that lives in the southwest of America, is actually credited as the origin of glucagon-like peptide 1 analogs. You may have heard them trademarked as things like Ozempic or Mounjaro. And these are very powerful anti-diabetic agents used to establish tight glycemic control now in many patients. Another example is that the venom of an African snake species called the pit viper was the origin of a class of antihypertensive drugs called the ACE inhibitors, or angiotensin converting enzyme inhibitors. And these are both used for high blood pressure control as well as kidney protection in the context of diabetes and other kidney diseases. So how did a cancer assist us in treating another disease? But let's explore the treatment first. It's called tPA, or tissue plasminogen activator. What is tPA used in the context of? Well, it's used in the context of a stroke. On the top left here, we have a very useful mnemonic used to identify the features of a stroke that is happening acutely. This is the FAST, or F-A-S-T mnemonic. A patient will often present with asymmetric facial drooping, arm weakness, which is also asymmetric, and speech difficulty. All of these signs are reasons to call 911 or medical help in an emergency. Once there, a patient will often receive something called a non-contrast CT of the head or computed tomography of the head, which is essentially a series of X-rays collated together to give a complete three-dimensional picture. Here, in this coronal CT of someone's brain, you can see this dark mass, which is actually a mass of dying neurons that are releasing their free water, hence the dark coloration. That is a sign of an ischemic stroke that requires medical attention. If it has been within 4.5 hours of this stroke-like insult, then a doctor will usually push something called tPA. It goes by other trade names such as alteplase, tenecteplase, or retaplase, and it's usually pushed through an IV or an intravenous form. On the right here, you can see that this is an angiogram of someone's cerebral vasculature or cerebral blood vessel tree. You can see this huge occlusion that is preventing blood flow into the anterior cerebral artery watershed. After injection of tPA, you can see that all of this blocked off blood vessel has now reperfused into its vascular territory, which shows you the power of tPA in busting clots, or it's doing something called thrombolysis, which is another word for clot breakdown. And indeed, tPA has a very statistically significant increase in survival in stroke patients as compared to the control, or what we were using before to treat strokes. So how does tPA work? Well, plasminogen activator is actually a serine-type protease, or an enzyme that breaks down proteins. And it specifically breaks down plasminogen, which is an immature protein product, into a mature protein product called plasmin. Now, what does plasmin do? Well, you can see on this diagram on the left here, there's a flowchart of what plasmin does to fibrin. So what is fibrin? Fibrin is, you can see this image of these red blood vessels covered and entangled in this mesh of kind of spider web. That spider web substance is actually fibrin. It is the endpoint of the clotting cascade, as we call it in hematology, and it essentially binds together a clot and the clot-associated substances very tightly in order to prevent their breakdown. So what plasmin does is that it tears apart this fibrin spiderwork mesh into something called fibrin split products, or D-dimer products. And these are soluble in the blood, so essentially the fibrin mesh is broken down and solubilized. And so this is why we call plasminogen activator a clot buster, because it breaks down this fibrin mesh. Now, tPA can be used in other thromboembolic events or clotting events where a clot gets stuck in a large blood vessel like an artery or a vein. So it can be used in the context of a heart attack if stenting is not indicated. It can be used in the context of a lung clot or a pulmonary embolism. And it can also be used for DVTs, which are clots that form in the deep veins of the leg, which are very dangerous in that setting because they can travel to the lung and cause a pulmonary embolism. However, you cannot use tPA if a patient has a history of intracranial or gastrointestinal bleeding. Why? Because in the context of severe bleeding, you want clots to form instead of the opposite. And of course, tPA prevents the formation of clots because it breaks them down by its nature. The good news is that tPA can be reversed by an anti-fibrinolytic agent called tranexamic acid, or TXA, also called Amicar. And this is used very judiciously in the context of trauma surgery to promote the formation of clots. So where was plasminogen activator even discovered? So there was a very insightful discovery of a specific cell line called Bose melanoma cell line, which is extracted from a specific patient called Mr. Bose, who is most likely now deceased. And Bose melanoma cell line secreted this plasminogen activator, as was discovered by Dr. Reich in 1970. And in fact, the initial name of plasminogen activator was malignant plasminogen activator. So previously, the clot buster of choice was something called streptokinase. As the name suggests, streptokinase is derived from streptococcal bacteria. You may have heard of it in the context of a sore throat, like strep throat. And this was used, but it has the very predictable side effect of causing severe immune and allergic reactions, because obviously our body is primed to immediately reject and attack any sort of bacterial origin protein. And so that was the problem with streptokinase. So let's backtrack a little bit and go into how melanoma spreads. So melanoma is a cancer derived from the melanocytes of the skin, which are a type of skin cell. Melanocytes, as the name suggests, secrete something called melanin, a dark pigment that is present in our skin in order to absorb the harmful energy and the harmful effects of ultraviolet radiation, which is a very energetic form of the electromagnetic spectrum of radiation. And of course, UV light induces double-stranded and single-stranded breaks in DNA, which, when they are repaired by erroneous means, such as mismatch base repair or non-homologous recombination, can actually promote oncogenesis or cancer development through the acquisition of new harmful mutations. Now, melanoma is very interesting as compared to other cancers because it has a very aggressive tendency to metastasize or spread beyond its local tissue environment into distant sites far away from the skin, such as the liver, the lungs, and the brain. And you can see in the top left here, the top left image, we have a liver from someone who has obviously been autopsied, and it is spotted with these dark melanin-rich metastatic melanoma foci. You can see that in the lung here. And then finally, in these black tarry spots on the outside of someone's brain, you can see that these are all metastases of melanoma into someone's brain. And this is quite unusual because other common cancers, such as breast or prostate or lung cancer, tend to metastasize or spread locally. For example, breast cancer will often spread into overlying skin or the lymph nodes of the armpit or the breast, and into local bony structures such as the clavicle or the rib. But melanoma spots up or kind of appears in distant places seemingly at random. So how might it do that? Well, Dr. Reich in the mid-1970s, his team found that the degree of malignancy or aggressiveness of melanoma was actually associated with the amount of malignant plasminogen activator that was secreted by that specific cell line or cancer cell line. And that this protein had a very special affinity for fibrin and plasmin. And this special affinity initially caused them sort of consternation because it prevented them from, adequately purifying tPA from malignancy-associated clot products. But this was also a double-edged sword because then they found that this protein was very specific in the breakdown of clots. And that was a surprising discovery that eventually, of course, led to the elucidation of what tPA actually does. At the top right here, you can see a diagram that they very beautifully described or illustrated, in which it shows that plasminogen activator is kind of like a knife that cuts apart a leash or a muzzle that is present on this monster called plasminogen that tears apart and chews through fibrin. So that was a very interesting discovery that they made. And how might tPA expression assist in melanoma metastasis? Well, UPA and tPA are both, these plasminogen activator types. They are both, again, as I mentioned, proteases or protein chewing enzymes. So they can, number one, eat through the extracellular matrix, or kind of the shell that surrounds tissues, the fibrous shell, and that can eventually allow the cancer to break through the basement tissue of organs and invade into them and invade into blood vessels too, where they can then spread. tPA might also promote blood vessel growth or new blood vessel formation called angiogenesis into new tumor sites, and that is via plasmin activation. On the top here, this top image, you can see this nest of melanoma cells. Everything that is purple stained is actually staining for tPA, so you can see it expresses it very richly. And on the bottom here, as I mentioned, tPA is a serine protease, and that is its function of action. So you can see that this serine residue, it actually undergoes or conducts a nucleophilic attack on the carbonyl carbon of a unsuspecting protein. And that is its kind of mechanism of action and how it actually breaks down proteins at the molecular level. So I hope you learned something from this video. And I think this video is very instructive in that it relates how sometimes the interesting or the dreadful properties of cancer can give us some clues and insights into physiology and how that can help us in curing or treating other unrelated disease states like stroke. So thank you.